Evening to all our dear viewers, and welcome to this talk show conducted by Global Education and Training Institute. Ladies and gentlemen, today it's 10th of October, the World Mental Health Day. It is an international day for global mental health education awareness and advocacy against social stigma. It was first celebrated in 1992 at the initiative of the World Federation for Mental Health or Global Mental Health Organization with members in more than 150 countries. The day provides an opportunity for all stakeholders working on mental health issues to talk about their work. This year, as World Mental Health Day, comes at a time when our daily lives have changed considerably as a result of the COVID-19 pandemic. The past months have brought many changes for healthcare workers, providing care in difficult circumstances, for students adapting to taking classes from home, for workers whose livelihoods are threatened, for the vast number of people caught in poverty or in a fragile humanitarian settings with extremely limited protection from COVID 19, and for people with mental health conditions, many experiencing even greater social isolation than before. And today, to give us a talk and a presentation on this extremely sensitive issue, we have a very dynamic and high spirited young entrepreneur, Ms. Esha Sridhar, who is the founder director of Plain Jar Foundation that provides psychosocial aid for mental health abuse victims. She is a student researcher studying the impact of the sex offender registry on the lives of people on it. She is currently pursuing her major in sociology and a double minor in global business and nonprofit entrepreneurship. She is also the founder of the CAASA training program that has trained over 120 people in being primary mental health responders. We welcome you, Esha, here on this talk show, and we would definitely be looking forward to a very effective presentation from your side. And I'm sure that the viewers must also be very anxiously waiting for such an grave issue, such a sensitive issue to be touched by a youngster. Over to you, Esha.
Thank you so much, Ms. Sumita. Um, it's an absolute pleasure to be sitting here before you and to be able to give you this presentation. Mental health has always been a topic that I hold very close to my heart. And that's not only because of the impact it has had on me personally, it's also the fact that mental health not only plays a role in one's own well being, but also plays a dynamic role in ensuring the well being of everyone around us. I truly believe that if one person's mental health is poor, it affects their family, it affects the lives of everyone around them. And so we owe it to ourselves and we owe it to society in general to be able to counter that, to be able to find a way to work on our own mental health and to be able to actually adjust to the society around us. Like Ms. Sumita said, with COVID right now, it has been an increasingly difficult time, especially for educators and students. As a student myself, I know the toll it takes on a student to be able to log in the morning every day, lack of access to the internet, the fact that you can't leave the environment of your own home. And often for a lot of students, and it's unfortunate, the situation is that the home itself provides a very insecure environment. Sometimes there's abuse within the household, there's interfamily conflict. And in a time like COVID, you could have other relatives falling ill all the time. And this is a very hard situation to navigate. Then I come down to educators. For educators, I find it an even greater challenge at this point. For an educator to be able to take care of their own well being within the home itself, and then to be able to show up and be present for their students on a daily basis is something that is very taxing. I've had my own professors mention this to me. And I've also noticed this as a CASA trainer and as someone who hosts training programs for mental health well-being on a regular basis. Um, so I'm going to jump right into it. So today, what I have planned for you is to look at how mental health plays a big role in the social and legal element of taking care of folks around us. So that means that I will be running you through what mental health looks like, what are signs and small cues that you can maybe pick up on the folks around you, and how can you as an individual, as someone who isn't trained in psychiatry, someone who isn't trained in mental health well-being, how can you do your part? What I call this is intuitive mental health. Intuitive mental health basically is based on your own intuition. It is your ability to look at a situation and say, with the way I see the situation taking place right now, what do I think I can do in the situation? And how can I, as someone who's not trained, what is my body telling me? Is it telling me to stop shouting at the person? Is it telling me to refrain myself from voicing my opinion right now? And so that's intuition. It comes with a large quotient of emotional intelligence as well. So I have a couple of slides here, and I will be showing you just about 5 to 6 slides here and there so that you can get a gauge of what it is that I'm trying to convey to you today. So we can jump right into it. So first, to start off, what is mental health first aid? Share my screen there. Okay. The first thing is, what is mental health first aid? When we look at mental health first aid, we're looking at it's the help offered before someone goes to get professional help, which means that it could be a situation wherein you are at home, you could be a parent, you could be a sibling, and someone else in your home is dealing with some kind of mental health distress. And I'm going to teach you today how to identify that mental health distress. And it is your job before you can take them to a professional to ease them into it. Getting professional help can be very, very scary. As someone who's gotten professional help and had to go through the process of getting it, it can be very overwhelming. And sometimes the process of getting help for your mental health can be taxing in and of itself. So the first thing in a mental health first aid person would be to provide help before they can get professional aid. The second point would be to offer a person with developing mental health problems or in a time of mental health crisis. So this could be once the person goes to therapy. Let's remember, therapy is only 1 hour a week, maybe 2 hours a week if a situation calls for it. But the rest of the time, there is a lot of self-care that goes into it. And you need to be able to provide for another person without letting it take a toll on yourself. And you might notice this with students that you teach. I know that a good part of our audience today are teachers and working professionals. And so this could be with colleagues that you see, this could be with other students that you see. So when you provide help to someone else, you can't let it take a toll on your own mental health, because it's kind of like the airplane thing. You put your own oxygen mask on before you put it on for your child, right? So that's what we work on. And appropriate treatment and support until further aid. And so this would be, there are some certain strategies of when we go into a mental health crisis of some kind. So this could be a depressive episode, it could be a panic attack, it could be an episode of mania, or it could just be a lot of tension suddenly. You realize that your body kind of disorients itself. You don't know what's happening, you can't tell what's real. Your mind is running at such a pace that it is your job as the person who's sitting and watching it happen to someone else. You have to help them to be able to get themselves back down onto the ground. You're trying to ground them. And so I will be teaching you also a few techniques that you can maybe use on students that you have or on other working professionals that you work with or in your family itself. And how can you do that? Okay, so the aim of what we're trying to do is to preserve life. The first part of preserve life is when situations like, even if it's minor things like panic attacks, depression and things, if they're not looked after and if they're not tended to right at the beginning, the situation can get very out of control very quickly. We often have a tendency to downplay the magnitude of mental health, and rightly so, because it's so prevalent that it can be scary. To be able to think that something as simple as your heart racing could lead to suicidal tendencies in the future is a very scary thought, and you don't want to put that on anyone. You don't want to even believe that someone in your life may be feeling something like that. And so the first job that you have, that as a mental health responder, as someone who's trying to just respond to someone else's mental health crisis, is your main goal is to preserve life. The second, sorry about that. The second is to de-escalate the situation. De-escalate the situation would be that this person may be trying to say, I want to leave the house. I don't want to do anything. I want to quit college. I want to quit school. I want to quit teaching. And so the first thing you have to do is de-escalate the situation. To be able to get that person back to ground, you can say, okay, give it 10 minutes, give it some time. Let's see how it goes. And so that's the second step, de-escalating the situation. And the third step is enhancing recovery. Once a person is in therapy, once a person is getting actual help, what you can do is enhance their recovery by making their workplace, making the process of educating them a safe environment where they're not scared, where it actually promotes well-being and promotes their education rather than holds them back. Okay. Now, a action plan that I usually follow for mental health is called the Elise Action Plan. And this is a plan that I created after having worked with several clients who go through mental health problems, right? So the first thing is to be able to assess the risk and your ability to help in the situation itself. So when you assess for risk, the first thing you say is, okay, I see this person is maybe having a panic attack, and I'll get to what a panic attack is in a couple of slides. It's usually a symptom where your heart starts racing, your hands and ears get sweaty. It could be because of exam stress. It could be because sometimes it's within the body itself and it can't be controlled. So sometimes it could be caused by the smallest of triggers, a door shutting, or someone opening a window, someone walking in and saying something very loudly. We don't know what triggers other people. But when they do get triggered, we say, okay, let's assess the situation and see how we can help. The second step goes to listening non-judgmentally. Listening non-judgmentally is very, very difficult. Judgment is natural. It comes in because we believe that we've experienced life. And so based on our experience of life, why can't the other person learn from our experience? And it's sometimes very hard to be able to understand, I can deal with the situation. Why can't this other person deal with the situation? It's just exam time. It's just stress. It's natural. What's going to happen? We have to understand that every person's body deals with the same situation very differently. And that's what makes us unique, right? As human beings, that all of us have a very unique method to be able to cope with mental health, to be able to understand things, to be able to comprehend things. And so a large part of what your job in that situation is to see, okay, in my life, this is how I deal with it. What about in their life? What is their frame of thinking? How are they approaching this issue that I'm talking about? What do they feel about it? And so when you're able to look at it from that perspective, you are just listening silently. You're listening to them. You're being receptive. You're saying, tell me more. You're saying, I'm sorry that made you feel like that. And you're listening to them without posing judgment of be more mature, you have to grow up, none of that. The third step is inquire by asking what they want to do and clarify any doubts they have. So this may be, they may want to do something. So they may want to suddenly say, I want to leave my family. I want to go out. I want to quit my job. I don't think I can do this anymore. I don't want to live anymore. Things like that. And so when you ask them what it is that they think they want to do, even here you have to listen non-judgmentally, and some of their responses might be very scary. Things like hearing someone say, I don't want to live, I want to end my life. We have to first take that very seriously. And because we're taking it seriously, we also have to sit back and say, this person's speaking, and I'm just going to listen to them. The third, the fourth, the second E. The second part of it is explore options of help together. Now, when someone goes through a mental health crisis, one very important factor is to give them a sense of autonomy. It's to say that, yes, you're going through a lot in life right now, but I'm still going to allow you to make some decisions on how you want to deal with this. So one example that comes to mind is I had a case once where an educator met with a student of theirs, and the student got close to the educator, got comfortable, and they were talking. And once a student said, ma'am, you know what, I don't think that I want to live in my house anymore. I think I'm going to leave. I feel very sad all the time. I feel very depressed. I don't know what to do. I don't know how to deal with the situation. And so the teacher said, oh, that's okay. But as my job as a teacher, I can't let you do that. Because if you do tell me that you're going to run away, I'm going to have to tell your parents. But here's the thing, we can do two things. One is, I can make these decisions and I can tell your parents and all of that. The second option is that you can do it yourself. Or you can go to your parents and tell them what it is your troubles are. You can go to your parents and tell them that this is what you're hoping to do and this is what you think the situation has come to. And so by doing this, you've given the person two choices. You're saying either you will do it or they'll have to do it. But the fact that you've given them choices is what matters. And that's what you have to do. You have to try to give them as many choices as possible, because we need to regain control of our own lives. And when you feel like you've gained control, the mental health crisis comes to peace, it starts dialing down, and you're able to work with the situation better. The last step is strategize help or strategies for a health plan and self-care. So these strategies could be every day after you come back from work, to be able to set a routine. So you say, after I come back from work, I have a cup of chai, I eat something, I watch TV for 10 minutes, and then I get back to work. Or it could be when if you realize that a student gets very, very stressed out during exam time, you as an educator or as a parent could come up with a plan with your child that says, okay, you have to take care of yourself, because if you don't take care of yourself, exams are going to get hard. So during exam time, let's say you can go out or go for a run or play football for 15 to 20 minutes during exam time. So these self-care strategies are very important because it helps you realize that there's more to your life than just the task at hand. There's more to your life than just the exams. And it's very important to remind people of that. Now, this is an interesting thing. And I think some of you may be familiar with this, but I still thought it was very important to highlight what it is. So this is a little diagram that we have, which is called the panic attack man. And so basically it is showing all of the symptoms that take place in someone's body when they're having a panic attack. So let's see some of the symptoms, shall we? There we go. So some of the symptoms are, there is a sudden increase in heart racing and palpitations. You can see that in the heart shape right over there. You might have difficulty swallowing. Have you noticed when suddenly all of your plans change, or when you realize that, oh, you had to reach someplace and suddenly you can't find a single taxi to take you there, or you have a deadline and you're already about an hour late to meet it. You suddenly have a sense of fright hit you. Your heart starts racing, your vision sometimes gets blurry, you can get dizzy or lightheaded, your mind starts racing. What if this happens? What if that happens? What if this happens? And it starts looping on and on and on and on. Then you'll have, some people have nausea. They want to throw up. They can't keep it inside. And some people have a lack of appetite. During a stressful time, they simply can't eat. You get restless. You want to kind of run, or you want to freeze up and get stuck. And these are just some of the symptoms that could come in place during a panic attack. But some of the most common ones are that your heart starts racing, it gets a little hard to swallow, and your mind starts racing as well. These are the most common symptoms. So when you see someone facing any of these symptoms, what you have to be able to do is you have to be able to first identify it. So identifying it comes with saying, okay, this person is, so a method of identifying it could be this person is talking suddenly much faster than they usually talk. And most of what they're saying is kind of spinning off of each other. It's their mind racing in such a way that it's hypothetical situation after hypothetical situation. What if this happens? And that'll happen, and that'll happen, and that'll happen. And the person starts getting scared. And they get so scared that their heart starts racing. They say, I need water. I'm freaking out. I don't know what to do. All signs of a panic attack. In situations like this, like I said, you have to look. So first, You assess the situation and you say, is this a panic attack? Have they had one in the past? Are they losing consciousness? Sometimes people panic so much that they pass out, and that's what you want to prevent. Because if they pass out, it's hard to do anything, right? Because you don't know whether the passing out is medical, you don't know if the passing out is an actual heart condition and they're passing out because of it. So the first thing is, if you look at someone who's panicking, you don't say, are you having a panic attack? You usually say, you seem like you're really scared right now, or you seem like your mind is racing. Does this happen often? They may say yes or no. They may say, yeah, it happens all the time. It's normal. I'm used to it. That may also be a sign that they've had so many panic attacks that now they're just like, it's part of normal life. But we have to try to change that, because no one deserves to live an entire life of just panic attacks. The second step will go on to listening. Listen to what they're telling you, listen to their symptoms. If they say, I'm getting dizzy, let them sit down, give them a glass of water, put some electrol in it. Inquire, ask questions. Say, would you like a blanket? Are you feeling cold? Are you feeling really hot? Do you want to go outside and get some air? So these are inquiry questions. Then you have a chance to explore and strategize. When I say explore, it means explore options. And only do this once you've calmed down a little bit. Once you've calmed down a little bit, you can say, okay, what do you want to do in this situation? Obviously, this situation makes you very stressed out. So if this happens again, how do you want to deal with it? And then once they tell you what they want and what is it that they want from this situation, that it doesn't happen again, you can strategize. You can say, get professional help. You can say, why don't you call a friend and talk to her or him? Why don't you find ways to adjust by going to maybe therapy, or going and visiting a doctor, or maybe taking some time off playing with their pet dog, playing with their pet cat. You can find small different things that bring joy. Once a panic attack is over, go slow. Calm yourself, calm your own body. As a person who's viewing someone else having a panic attack, we often tend to raise our voice because their voice is going higher. So they'll say, I'm panicking. You'll say, why are you panicking? And then slowly it goes higher and higher and higher. You have to ensure that you stay in an equilibrium. You stay calm. You know what is happening. So the first thing is, speak softly. So a speak softly would be, this is me speaking at a normal voice. After a person usually has a panic attack, you try to dial it down. And you say, can I get you some water? Can I make you something to eat? Would you like space? Would you like me to leave the room for 10-15 minutes and then come back later? I can go and buy something to eat, something like that. And so by dropping the voice, we as human beings like to reflect our behavior off of other people. So when we see, it's like the positivity thing, when everyone around you is very positive, it bounces back on you. That on its own has problems. But in this situation, if you can stay calm through someone else's stress, they learn that behavior off of you. And so when you can keep calm through a panic attack, they try to equate their own mood and behavior according to how you're reacting. So if you stay calm, they can stay calm too. And remember, after a panic attack, it's kind of like a bear just chased you. Imagine being chased by a wild rabid dog and you're running and running and the dog's just chasing you. Your heart is racing, you're cold, you're hot, all at the same time. That's what a panic attack is. Your body is going through all those sensations without the rabid dog chasing you. And so afterwards, the person is tired. They're exhausted. And so you kind of have to treat it as a person who's just come out of the hospital, maybe, or someone who needs bed rest, at least for a few minutes afterwards. And so don't like suddenly start moving things, making noise, picking up a bartan, banging a spoon. Go slow, go calm. Think of it as a baby sleeping. And so you kind of need to be a little careful about all your actions that you're doing. So just slow down a little bit. If you're opening a door, don't just bang it open. Slowly open the door, step out, and take care of the situation like that. Next is, give them an option of taking a break from whatever they're doing. So if they're panicking as they're looking at an assignment and they're typing and they're like, oh no, 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 say, okay, step away from your laptop for 10 minutes, come for a walk with me, we'll go get something, and then we'll come back and then you can continue. So give them an option. Last one is, provide the option of professional help. Professional help is scary. No one wants to go to a therapist because you don't want to believe that there's something so wrong with you that you need another person to help you with it, and you have to pay that other person to help you with it. But professional help is a real art. They've trained for years on end on exactly how to deal with this situation, on how to help you navigate the situation the next time it happens. They're not there so that they'll hold your hand, they're there as kind of like a crutch. And as soon as you learn how to walk, you let go of the crutch. And that's what therapy is. It gives you the support system needed until you can learn. And then eventually they let go and then you can move on. Okay. Now, these are some things that I strongly believe in how we phrase ourselves and how we phrase our own words. In an educational setting, what I've largely noticed and realized is that there's two parties that are always frustrated and really stressed out. One is the student, one is the teacher. Both people are stressed out, both have a lot of things happening on their plate. For a student, their body is going through changes, they have things happening in their own home. Students might be dealing with learning difficulties, learning disabilities, difficulty focusing, difficulty being able to sit still in class. They might be dealing with mental health problems around the 8th, ninth, 10th, between like the ninth grade to the 12th grade is a peak time when mental health things start acting up. Because of board exams and the way our Indian education system is designed, it tends to stimulate a lot of stress. And as your body gets stimulated to high stress situations, like during board exams, it's almost a year of just stress. In such situations, your mental health problems start kicking in. So stress often triggers mental health problems. And so you as an educator have to be mindful of the fact that that might be happening to a student. They may suddenly start saying, I'm not going to turn in any assignments. I'm not going to do homework. They may not study for tests. And these things, yes, could be signs of laziness, could be signs of giving up, could be signs of just not wanting to try. But they could also be signs of mental health problems. They could be signs of a lack of ability to focus. They could be signs of losing a sense of purpose, not knowing what's happening with their life. Their body is going through so many changes, they don't understand all of it. So we have to be mindful that students may be going through all of those problems. And that doesn't mean that you as an educator are responsible for solving all these problems. It's only being aware of them. And being aware itself is sometimes enough to change your behavior. Then we come down to educators itself. Educators, on a large sense, have problems happening at home. There could be problems of pay, there could be family members falling sick, or often a lot of educators have children of their own at home. And so if their child is sick, they're coming to school and teaching someone else's child. That can be very difficult for an educator to work out. You're working and helping out another child when your own child is sick at home or when your own child is unable to cope with something. And so mental health in a school is present in both parties, the party that's providing the education and the party that's receiving the education. And so we have to find a way to come to an equilibrium where we can understand that both parties have a lot on their plate. So here's the thing. So one thing that I always believe is that you have to be very mindful of the words that you are using in such situations. So if I say, let's see some of the words over here. Okay, you say that this child is unmotivated. This child is lazy. This child has no sense of ambition, is not driven. We might want to change the way we use those words, at least initially. So instead of saying, you seem so unmotivated to a student, you can say, it seems like you haven't begun this assignment yet. Can you tell me why? And what you do over here, yeah, this word seems very small. Unmotivated versus has not begun yet. Has not begun yet seems like a nice cover to put on it. But using that term, at least the first couple of times, might make all the difference in that student's life. Unmotivated sometimes comes on as a chapa. It comes on as a label. And the second you say unmotivated, lazy, unwilling to change, manipulative, this child is arrogant, non-compliant, These are words that are very heavy. And often in these formative years, when we use these words, it really leaves a scar. And the same thing works with teachers as well. So when you get performance reviews on something, instead of writing, when you review someone else, instead of saying something like this person is unmotivated, try to say has not begun yet. Instead of saying this person is non compliant or does not comply to task given, you can say is experiencing significant difficulty completing a task. So it's kind of like saying this person is depressed versus this saying this is a depressed person versus saying this person has depression. Difference being the first one labels you as a depressed person. It's like that's your whole identity. Problematic, right? Because you don't want that to be your only thing. So you say this person is suffering from depression. That means it's a condition, they have it, but that's not a descriptive word for them. And so in this way, your words really matter. Um, this is just the last segment of what I want to run through. And this is called Why Does Abuse Take Place? Now, the reason I link mental health with abuse is that a lot of mental health problems often it's kind of like a cycle. Mental health problems can lead to abuse, abuse can lead to mental health problems, and that cycle continues. And we see that in a lot of family life and family behavior. Um, I've had cases wherein the child is being abused by the mother is being abused by her husband, the husband was abused as a child. Complicated. What do you do in a situation like this? Everyone needs help, everyone is the victim, but in this case, is also the perpetrator. And that's very interesting, right? And we see this in schools as well, in bullying cultures, when students bully other students or when students resort to physical violence. What is happening there? So here's the thing. So this is a more criminological perspective, but I truly believe that we have to start working on these things when the person is a child itself. And the younger we can start, the easier it is to mold someone and to work with them. So violence can be caused by several things. There's personal traits, there's evolutionary factors, there's substance abuse, socialization and how they were brought up. There's are they exposed to violence? So exposure to violence could be, do they see their parents hit each other? Do they see emotional manipulation at home? Do they see it happen in school? Are their friends doing it all the time? Then you have cultural values. Each culture in different parts of India itself, the culture changes drastically. So some cultures or some households may believe that, I am going to, some parents may say, I've never hit my child. Some parents may say, I've only hit my child in the worst case situation. Some may say it's important to hit the child because that child learns, like that physical pain teaches them how to move on and teaches them how to be stronger. And so that's a cultural thing. It's something we learn from our parents, their parents learn from their parents. So it's a culture, right? And so looking at what is the culture that this child is in. Is violence normalized? Do people say it's okay to raise your hand? How does that work? How does it affect the child itself? And then you have personal traits and makeup, which is the psychology of the child itself. And I like to move away from this one. I understand that it's a very big part. And yes, we're all born with some things. Some children are more physically violent, some like reading more, and we're all unique in that way. But I also believe that when it comes to violent behavior or when it comes to deviant behavior of any kind, we have to not keep saying this person is just like that. Because the second we say that, our responsibility goes away. As an educator myself and as a student myself, I believe that the second I say that my student is just a violent person, I am automatically saying to myself and to society that this child will never improve because this child is broken on the inside and there's nothing we can do to fix it. And so ever deciding that someone cannot be worked on is a very serious statement to make. And so I would recommend avoiding that approach and looking at the others. One large thing that takes place, just let me expand the screen that you can see this. There we go. So one thing that takes place is abuse and isolation go hand in hand. So often in situations of bullying or in situations where sometimes you may see colleagues of your own may not be following teaching methods that you prescribe to. or maybe prescribing to methods that are, say, old school, or they're not as evolved as what you've been trained to do. And so often when the plain job, when my organization gets called in into companies in these situations, or gets called in to view the behavior of certain students, we see why are they continuing this cycle of hurting other children, or why are they not able to say what I'm doing is wrong. Or if we look at it from a violence perspective, from like a home perspective, we're saying, why does this abuse keep happening? Why is this parent continuously hitting their child? Why is the husband continuously hitting the wife? Or in any situation like that. And we realized through years and years of criminology study and all the forefathers of sociology and social work that have come before me, we've realized that the core point of this is isolation. When a person is isolated, you tend to start looking for ways to be not isolated. We're social creatures as human beings, right? And so when isolation hits, you say, okay, I'm going to reach out to people and find support. When you feel lonely, you reach out and you find support. What happens when you don't find support? That's the second part, right? You don't find social support. What happens then? When you don't find social support, you start doing things to cope with it. So you might start saying deviant means to access the same goals. So you say, okay, if this child is not listening to me when I am telling them, if I'm not able to get their attention, and this is not just isolation, like isolation not having people around you, it's isolation in your own motives. When you're the only one trying to work on a child and the child is not working with you, you feel isolated. You feel a sense of, I am putting in my 100%, but this child is not giving back in this situation. And so isolation is a big problem in that case. And so what we notice is to do our best to eliminate the isolation factor. And we can do this in many ways. For educators, it's often giving them a sense of community. When you have other teachers that you can talk to about things that are going on, when you have someone else saying your strategies are good, you're a good teacher, you know what you're doing, it prevents isolation. So even when things get hard within the classroom, all of your frustration doesn't come out in the classroom because you have a community you can go back to. The same thing happens with a child. If a child hits someone and the punishment is you can't sit with anyone and you have to sit on the last bench. I know some schools have like a you sit on a chair separately. And if the child keeps doing that, so the child hits someone, then you tell the class no one talks to him now, and then none of his friends talk to him again, and then he's even more isolated. So to get attention, he'll again go hit someone because then at least someone talks to him, and the cycle will continue. So the more you isolate someone, the more likely they are to do the behavior again to get attention. And so your goal always should be, is this person isolated? And whenever you're strategizing ways to help a student, help a teacher, help a colleague, always ask the question, is this person isolated? If they are, how can I reduce isolation? And in most cases, if not all, if you eliminate the isolation, the problem reduces drastically. This is called differential association, which basically says that I may believe that yelling at a child is a bad way to get them to do something. Someone else may believe that it's harsh and it hurts and everything, but that's how they learn. You have to yell at them. And so all of us associate different techniques with different things. In the United States, they have a general thing of saying, no, you can't even have physical contact. A teacher can't touch a child in any way, no physical contact, no hugging. However, in certain places in Europe, they say that's okay. If the student needs support and needs emotional support, you can go and you can hug the child if the child is going to feel better afterwards. And so all of us associate the same action, hugging, with different things. The housing society in which I used to live as a child, if I was even seen hugging a friend of mine or even my sister sometimes, hugging was always seen as a very intimate process and you can't do it publicly. And so that's because we all associate the same action with different things. And so when you're talking to a parent about how they're working with their child, the first thing is to see what is their frame of thought. How do they associate their own behavior at this point? So if you're trying to tell a parent, you need to shout at the child less, but be more involved in their schoolwork, The parent might say, I don't believe in being involved because I was raised studying independently. My parents never helped me. And whenever I did badly, they hit me. And so I'm going to do the same thing for my child. And so you have to realize that everyone's culture teaches them how to conduct the same behavior differently. And if you can understand their culture, only then will they even try to understand yours, and you can meet them at an in between. See? Okay. The last one is labeling, like I said. Labeling students, labeling teachers, labeling them as inadequate, labeling them saying lack of attention, lack of motivation. These labels, believe it or not, stay with the person. There's been a lot of studies that have been conducted, and I think Harvard released one of the studies that looked at how students associate words that they were called as children, and they looked at these children when they became adults. So they asked like 35-year-olds, what are some of the negative words you think when I say describe yourself to me? And often a lot of the words that they were told, saying lazy, inadequate, irritating, uh, arrogant, all of these words came up even when they were 35. These words stuck with them. These were words used on them when they were in school, lower school. This is first, second, third, fourth, fifth grade. And they said that because that word started then, you start identifying with the label yourself. You say, everyone says I'm lazy, so I must be lazy. And as a child, you can't counter that. It's very hard to realize that. And so throughout your life, you continue fulfilling what the word lazy means, because that's the only word you've ever been associated with. And we do this subconsciously. We don't even realize we're doing it. And so, in all of these ways, mental health can be a very, very taxing subject. And these are not methods that I've told you that are psychiatric in perspective. Like, these are not things that only a psychologist or a psychiatrist can do. These are things that we as individuals can do. These are things from an individual social perspective. um, this kind of leans into the socio-legal element of things too, right? So in a social perspective, if you're looking at mental health and you're looking at how can you provide help, how can you help a student come out of an environment that is toxic, abusive, what do you do? There are a lot of organizations that you can reach out to in such situations. Some of those organizations may be, every state has organizations of its own, and very fortunately, and hats off to our policing system for this, they have a lot of resources when it comes to child rights. We have a lot of amendments and acts in India that focus on the child itself, especially like the POXO Act, which provides relief from child sexual abuse. And so the police itself have departments that work with this. And as an educator, it becomes your responsibility, even if not legally mandated, to look out for the welfare of a child. And that does not mean that you have to be the one providing the welfare. It simply means that you sometimes have to be the one who has to take this first step to start that process. Yeah. So, in closing, when we look at mental health overall, we, again, going back to what I was talking about, look at how you can assess the situation, look at how you can gauge the situation, see how your own, look at your own emotions and say, how am I looking at the situation? How can I help the situation without it throwing a burden on me? And be open to exploring ideas, be open to talking to other people about it, and especially be open to asking for help on how to deal with the situation. Most of the work that my organization does is we get calls from educators, parents, children saying, how do I deal with the situation? And as people who work in the field and work on coming up with solutions on a daily basis, it's sometimes very useful to have that third party perspective. And so, yeah, I think that's what I have for this World Mental Health Day.
Well, thank you so much, Esha. Highly informative talk. And while you were giving a presentation,
Mm-hmm.
we have certain viewers who would like to clarify certain things on these very sensitive issues.
Mm-hmm.
Since you are working in this field, they would like to know that Is there any particular reason for you at such a tender age, at such a young age, that you have chosen to work in this line of work?
Um, I actually grew up in an abusive environment, and so as someone who underwent abuse herself, my main goal was to be able to provide relief and mental health care to other students like me. So I started off very early and very young. I started the company when I was 17. And since then, we've been working on creating a youth body. And now we work with professionals and folks much older than that. But it started off with a sense of we shouldn't be forced to get professional help. We should be able to come up with methods and techniques where we can help each other and not have to rely on someone else for our own well being. So, yeah, that's why I started this line of work. And I'm very happy with it.
You did mention about certain mental health services during
Mhm.
your talk. Are any of these mental health services available to those who come from impoverished backgrounds?
It is actually. So, very fortunately, our police system itself has a very interesting system called, they're called cells. And so, if you go to a police station and say a woman from a slum or from a rural area comes in and says, I'm going through these mental health problems and I'm going through problems at home, the police often diverts you to women and children's cells. And these people in cells are not mental health trained professionals, but they're socio legal trained. So they're trained on how to help with family conflict. And the people who work there are people from those communities. So they can actually identify with their problems. It's not like me stepping in and saying, I understand what you go through in the slum, because I don't. These are women who come from there and they're trained by the police, they're trained by educators, and they're trained to provide help to folks in rural areas. And I strongly believe in that model of to actually be able to understand the life of someone, you need to have lived it in some degree. And so, whenever possible, you try to give them resources from their own community. So, in cases like this, going to the police asking for legal cells, there's a lot of non-profits that step in. Plain Jar is one of them. We work throughout India. And every state has a directory of its own, which I'd be happy to share if someone would like. We have state-wise directories. So, we have one. We have for every state in India, and in every city, we have about 2 to 3 organizations that are available that you can reach out to based on your income levels, based on where you are in society, and things like that.
Well, thank you so much, Esha. Ladies and gentlemen, that was Esha Sridhar, also a recipient of a $10,000 grant from the Davis Prize for Peace to pursue the creation of a collaborative social legal cell in India, which she hopes will be a one stop point for holistic abuse assistance. Thank you so much, Isha, for joining us this evening here in India. And a very good morning to you once again, because I know you are staying there in America pursuing your course. And ladies and gentlemen, very soon we'll be meeting again with yet another very impressive talk conducted by Getty. Till then, good night from all of us.
Take care.
Ha, live show over.